Back when life was normal, he had a White House event, a kind of conference call on the topic of impact in the senior citizen community. Well, guess what? He's a senior citizen. He happens to be the oldest president to hold the office in our history thus far. Talk about that. Talk about things like comorbidities, a term of art from your business.
You bet. You bet. What we know, there's two independent risk factors for a bad outcome if you have COVID-19. One is age. So if you're older, that's a risk factor if you're infected with the virus to end up, unfortunately, in an ICU and see somebody like me. You don't want to see somebody like me in a hospital, and that's the risk factor. If you're, say, 65 and older, that's a high-risk group. Add on top, let's speak plainly about the president's medical history as we know it, not as the Surgeon General describes it, which is perfect, or as Dr. Connolly describes it as perfect. His BMI is elevated, meaning he is obese, overweight, whatever word we want to describe. That, in addition to who knows what else might be present. There's been concerns about his fitness when he walks down a set of stairs. I don't want to speculate on what might be or what may not be occurring, but at the very least, he has a significant comorbidity, a risk factor, in addition to his age, which is being overweight. The combination of the two, I've cared for several patients in the ICU who have that double whammy. They're older and they're overweight. If patients develop COVID-19 and they have and unfortunately they have a bad trajectory, meaning they start developing shortness of breath or a cough or fever, and then they need to come into a hospital, these are individuals that tend not to do well. So this is a very serious situation for the president. I'm glad Dr. Connolly mentioned he'll be very vigilant. He needs the top experts that are in DC to watch him closely. He's the president, after all, regardless of whomever's politics. He's our president at this moment. We all wish him well. But part of this is him hopefully being humble enough to acknowledge that perhaps the way he's been behaving and messaging has been wrong, and now he's unfortunately bearing the brunt of that consequence, which is not practicing good public health interventions like masking distancing. He's paying a price now. He's now having to quarantine. Hopefully, he remains asymptomatic, but yes, he is at risk for a bad outcome. Absolutely, Brian.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.